Welcome to AETCM, the emergency medicine channel. Today let us discuss about tetanus. Tetanus is caused by Clostridium tetani. It's an anaerobic gram-positive rod. Tetanus is a disease which occurs when the spores of the Clostridium tetani, which enters to a wound, which is normally this bacteria is normally seen in soil. It gain access to damaged human skin, and through that it get inside the tissue. Actually, the spores of this organism is contaminating the wound. From the wound, it grows and become the actual organism and produces toxin and toxin-induced problem there. When we discuss about the tetanus toxin, it's an exotoxin, that is tetanospasmin, that is produced in the wound. This toxin binds to peripheral motor neuron terminals, enters the axon, and it transported to the nerve cell body in the brainstem and spinal cord. In spinal cord, it specifically attacks the anterior horn cells. Here, it blocks the release of inhibitory neurotransmitters like GABA that will lead to increased activity of alpha motor neuron that produces persistent rigidity of that group of muscles. So it mainly affects the anterior horn cells, especially in the brainstem or spinal cord. That produces persistent rigidity in that group of muscles. That is a major problem which is produced by this tetanus toxin. It's an exotoxin. The name of the toxin is tetanospasmin. So here inhibitory transmitter release is blocked, that GABA release is blocked. That leads to continuous activation of muscles that produces rigidity. Now we can see the predisposing factors for tetanus. Contaminated wounds in non-immunized person, that means the person is not immunized for tetanus toxoid, TT is not taken properly. Obstetric patients after septic abortions, neonates during septic abortions or infection of the umbilical stem, post-surgical patients with necrotic tissues involved in the bowel flora, patients with dental infections and after some dental procedures, diabetic patients with infected extremity ulcers, patients who inject illicit drugs or contaminated syringes. All these things are predisposing factors. But the most common cause for tetanus in our country is contaminated wounds. Wounds are exposed to this organism. Now we can see the clinical features of tetanus. Generally, it produces increased muscle tone in all groups of muscles. That produces generalized muscle spasm, neck stiffness, opisthotonus, that is contraction of back muscle produces arched back, risus sardonicus or sardonic smile, sustained contraction of facial muscles, frontalis and angle of mouth is contracted. That results in risus sardonicus grimace. Board-like rigid abdomen is another important feature. When we examine the patient's abdomen, you can see generalized rigidity. Patient can also have apnea, hyperapnea, or pharyngeal muscle spasm. All these things are also seen. Lockjaw is another feature. Dysphagia due to laryngospasm. So this mimics even rabies also. So rabies also will have similar type of features, but that will be intermittent. Here it will be persistent. So this is opisthotonus, contraction of back muscles producing arched back. This is risus sardonicus, sardonic smile, sustained contraction of facial muscles. So persistent smile-like contraction on the facial muscles. Now if you see the spasm of especially in the laryngeal, pharyngeal or facial muscles are triggered by small stimulus, sensory stimulus or physical contact, or even light can trigger the tetanic spasms. So we keep the patient in dark rooms. Since the patient is fully conscious, both tonic contractions and spasm are intensely painful. So during the progress of the disease, patient will be continuously conscious. This is one differentiating feature from neuroleptic malignant syndrome. Neuroleptic malignant syndrome also can have similar feature, but here the consciousness is fully preserved, but whereas in NMS, patient will be mostly unconscious or in altered behavior. Dysphagia due to laryngospasm, we can simply test with a spatula. It is known as spatula test. Is a clinical test for tetanus that involves touching the posterior pharyngeal wall with a sterile, soft-tipped instrument like a spatula. Patient will try to bite the spatula and he will not release the spatula. Now, many patients with tetanus can have autonomic dysfunction. We know that autonomic dysfunction can have postural hypotension, tachycardia, bradycardia. ECG may show changes like ST elevation, ST depression. So there are a lot of cardiac arrhythmias can be produced by this autonomic dysfunction. Even hypotension or hypertension, both are possible in autonomic dysfunction. But there are various different features for sympathetic and parasympathetic dysfunction that is also can be seen in many patients who is having tetanus. There are variants of tetanus like local tetanus, spasm of muscles around the wound. Neonatal tetanus commonly occurs within 14 days of birth and it manifests by rigidity, spasm, trismus, inability to suck, seizures. Cephalic tetanus, patients with injuries to the head or neck may present with cephalic tetanus involving initially only cranial nerves and subsequently develop generalized tetanus. Now, mortality rate in tetanus is very, very high. Patients with shorter incubation period have high mortality, and mortality is up to 50%. Now, differential diagnoses are very important. Drug-induced dystonias. It is mainly seen in metoclopramide. After metoclopramide injection, you can see many patients develops dystonia, especially on the facial and hand muscles. Trismus due to dental infection. Strychnine poison, neuroleptic malignant syndrome. That is one of the most common differential diagnosis for tetanus. You can differentiate neuroleptic malignant syndrome or serotonin syndrome from tetanus, that is by the consciousness level. In tetanus, patient will be fully conscious, whereas in NMS, patient will be having altered behavior. So these are the physical findings of neuroleptic malignant syndrome. This is mostly produced by antipsychotic medicine. They resembles tetanus patient. They have generalized rigidity, fever, tachycardia, hypotension, delirium, lead pipe muscle rigidity, autonomic instability, tremors, mydriasis. All these things are similar to tetanus. Only thing, patient will have altered behavior here. Delirium is a classical feature which differentiate tetanus from NMS. Another important differential diagnosis for NMS is serotonin syndrome. So serotonin syndrome also can have similar feature like NMS and tetanus. So here there are some differentiating feature between serotonin syndrome and NMS. That is, pupillary findings are very important. That is, mydriasis in serotonin syndrome, NMS, that is normal. But this is also produced by antipsychotic drugs. So the treatment of NMS and serotonin syndrome are almost similar, but the treatment of tetanus is entirely different from these two conditions. Now, treatment, when we are treating the patient with the tetanus, you can treat the patient with either antitoxin or human tetanus immunoglobulin, 3000 to 6000 unit intramuscularly in divided doses because the volume of the tetanus immunoglobulin is large. Human tetanus immunoglobulin is given IM with part of the dose infiltrated around the wound. Human tetanus immunoglobulin should be administered at a different site than TT. Tetanus toxoid should be given in one side of the deltoid, and the other injection, human tetanus immunoglobulin, should be given partly around the wound, partly around some other area other than where we are given tetanus toxoid. All patients with tetanus should receive active immunization schedule for tetanus, so that tetanus toxoid should be given, at least 2 doses should be given at least 2 weeks apart. Other than immunoglobulin, now we have to control the muscle spasm. Muscle spasm, one of the easiest thing what we can do is diazepam can be given at dose of 10 to 30 milligram IV, and it can increase to up to 500 milligram per day. This is the problem in tetanus, because we need to give very high dose of diazepam. Comparing to other condition, we need to give higher dose of diazepam, but midazolam is a short acting drug that can even be given as an infusion. So our aim is to control the muscle spasm. Neuromuscular agents also can be tried. Rocuronium also can be tried. Rocuronium dose is 0.6 to 1 milligram per kg with neuromuscular blockade can be tried, or continuous infusion also can be tried. So tetanus spasm should be controlled with diazepam or midazolam infusion, or neuromuscular blocking agents should be given. Otherwise, we will not be able to control the spasm. And since the recovery is prolonged, most of these patients may require mechanical ventilation, tracheostomy. All these things should be given, tried very early. So it is very important to recognize the tetanus initially itself and try to ventilate the patient as soon as possible. And many patients may require tracheostomy because the recovery period is very prolonged in tetanus. Next thing is to control the infection with antibiotic. Metronidazole is traditionally the agent for treatment of tetanus. 500 milligram every 6 hourly can be given. Alternatively, we can give doxycycline 100 milligram 12th hourly, or we can go for penicillin 10 to 12 million units IV for 10 days. So both metronidazole or penicillin has got equal efficacy, but we always try to use metronidazole as a first line choice. Now, autonomic instability should be treated with magnesium sulfate or labetalol or morphine. Magnesium sulfate 5 gram followed by continuous infusion of a rate of 2 to 3 gram per hour can be given. IV labetalol should be given if there is a tachycardia or ST elevation, or if the patient is having hypertension. Labetalol is a choice, that is both alpha and beta blocker. Labetalol IV infusion 0.25 to 1 milligram per minute infusion should be started, but it should be always associated with magnesium sulfate or morphine. Morphine continuous infusion of 0.5 to 1 milligram per kg per hour can be given. All these drugs are used in autonomic dysfunction. Now, supportive therapy is very, very important. Many patients with tetanus who require mechanical ventilation, intubation as soon as possible. Patient has to be intubated, because once the patient develops laryngeal spasm, and this even minimal trigger can produce severe tetanic spasm. So once you diagnose tetanus, initially itself it is better to intubate the patient, completely knock down the patient. Many patients may require tracheostomy because the recovery period may be nearly 1 month in most of the tetanus cases. Nutritional support is very important in all these patients. DVT prophylaxis, low molecular weight heparin should be started for all patients who is bedridden for more than 1 or 2 days in your ICU. So even in tetanus also, we know that patient may take several days to recover. So we have to start low molecular weight heparin to prevent DVT. Tetanus toxoid or TT injection, first and second dose are given in 4 to 8 weeks apart. This is a primary immunization schedule. Third 6 to 12 months after second booster dose should be given every 5 years. So that has to be given to prevent tetanus. Post-exposure passive immunization, tetanus immunoglobulin following sufficient exposure to unimmunized or incompletely immunized person. Dose is 250 unit IM. So this post-exposure means whenever we treat a patient with severe trauma or a road traffic accident with heavy skin contamination, we have to give preventive dose of tetanus immunoglobulin. That dose is 250 units IM, but the treatment is very high dose, 3000 units we have seen in the previous slides. Preventive dose of immunization is tetanus toxoid injection, that 1 to 2 doses in 4 to 8 weeks apart should be given. So we have discussed about one of the important problem, that is tetanus. Tetanus is very common in our country. Nowadays, even in emergency room, we can get tetanus. That is mostly because after road traffic accident, contaminated wounds, septic abortions. Nowadays, the incidence is coming down. But even then, in rural areas of India, you can get this type of cases. Whatever it is, the high index of suspicion is very important. Whenever we suspect tetanus, immediately start the treatment. At least start antibiotic like metronidazole and give diazepam to control the spasm. That is very important. Even baclofen also can be tried in severe muscle spasm. Thank you.